Hello, I'm Karen Hoffman, a board-certified and fellowship-trained otolaryngologist or ENT surgeon. Today, we'll discuss septoplasty and inferior turbinate reduction surgery, which can help improve your breathing through your nose. We understand that considering surgery can be stressful, so we'll walk you through exactly what to expect before, during, and after the procedure. This video provides general educational information about septoplasty and turbinate reduction surgery. It does not include all possible risks, complications, or outcomes. This content is not medical advice and should not replace direct consultation with your healthcare providers. Each patient is unique, and your specific situation, risks, and expected outcomes should be discussed in detail with your surgeon. Always follow the specific instructions provided by your medical team. Inside your nose is a wall of cartilage and bone called the septum, which separates your left and right nasal passages. When this wall is crooked or deviated, it can block airflow. Additionally, the turbinates, those natural structures that warm, humidify, and filter the air, can become enlarged, further blocking your breathing. Common symptoms you may experience include difficulty breathing through one or both sides of your nose, chronic nasal congestion, frequent sinus infections, nosebleeds, and even snoring. When conservative treatments like nasal sprays and allergy medications don't provide relief, surgery may be recommended. Surgery is performed entirely through your nostrils. There are no external incisions. It is typically done either under general anesthesia or IV sedation. The picture on the left side shows a significant left-sided septal deviation touching the inferior turbinate. A balloon is placed along the floor of the nose and then expanded and held in place for 2 minutes. The balloon is then deflated and the procedure is repeated on the opposite side. We can then remove any remaining deviation of the cartilage and bone. We do this by carefully lifting the membrane covering the septum. We can then reshape or remove the crooked portions of cartilage and bone and then reposition the septum to the middle of your nose. The incision is enclosed with absorbable sutures. We will also reduce the size of the turbinates while preserving their important function. Sometimes we place soft splints to support healing. The procedure typically takes between 60 and 90 minutes. This is an endoscopic photo of the patient before surgery with a left-sided septal deviation approximating the inferior turbinate. The second picture is 2 weeks post-operative, when the patient had significant improvement in the nasal airway. After recovery, you can expect improved nasal breathing, potentially better sleep quality, reduced snoring in many cases, and maybe even fewer sinus infections. Most patients report significant improvement in their nasal breathing within 2 to 3 months after surgery, though initial benefits may be noticed sooner. Your nose is oftentimes congested, almost like you have a cold for the first week after surgery. Most patients do notice some improvement in their nasal breathing as soon as the nose is cleaned out in the office, usually a week later. While septoplasty is generally safe, it is important to understand possible risks. Common temporary side effects include nasal congestion and pressure, typically for 1 to 2 weeks, mild pain or discomfort, temporary numbness of the upper lip and teeth or tip of the nose. This usually occurs because of use of the balloon and should resolve typically within a couple of weeks. Minor nosebleeds are also common when we don't put packing in the nose. Less common risks include the following: infection, which occurs usually less than 1% of cases. A septal perforation is possible, which is a small hole in the septum. This typically isn't bothersome to the patient and nothing needs to be done. You can have a change in the sense of smell, which is usually temporary and usually due to swelling of the soft tissue. There could also be alteration in the external nasal appearance, but that is very rare. We do take multiple precautions to minimize these risks. This is the recovery timeline for most patients. Surgery is usually done as an outpatient, meaning that you will go home the same day. During the first week, we expect patients to have nasal congestion, mild pain, and drainage from the nose. Usually at about 1 week, the patient is seen in the office and splints are removed if they were placed, and the nose is cleaned out in the office or debrided. This improves the nasal congestion. Most patients can return to completely normal activities within 2 to 3 weeks, and almost everyone is completely healed and recovered by 2 to 3 months. These are the postoperative instructions that will speed recovery and help the patients feel better sooner. You may sleep with your head elevated to decrease the drainage in the back of your throat. You should use nasal saline irrigations 3 to 4 times daily to clear the crusting and mucus from the nose. You should continue to use any nasal sprays that were prescribed, such as nasal steroids or nasal antihistamines, as directed, but typically twice daily. Avoid strenuous activity for 1 to 2 weeks and no nose blowing for 1 week. Pain medication can be taken as needed. Remember, every patient's care plan is unique. If you have specific questions, please contact our office. Thank you for letting us partner in your healthcare journey. Don't forget to like, share, and subscribe.